So a very common question patients have regarding rotator cuff tears is what happens if a rotator cuff tear goes untreated? Right? This is a wonderful question, right? Because let's say you've had shoulder pain for a while and you go see a doctor, any doctor, and they order some type of imaging. And the imaging, typically it's an MRI. We use ultrasound, but most of the time you're going to get an MRI. And it's going to come back and say, you have a torn rotator cuff. And you say, okay, what do I need to do? Often what you'll do is go see an orthopedic surgeon. And many orthopedic surgeons are going to tell you, oh, you have to have surgery. You have to have surgery for that. If you don't have surgery for that, what's going to happen is the tear, let's say you have like a 1 centimeter tear. Well, now it's going to turn into a 2, 3, 4 centimeter tear. The tendon's going to retract. And I tell patients, the analogy I give is your rotator cuff is like an accordion, right? It's a group of 4 muscles, but it's a muscle to a tendon. And this accordion, if it tears, it can shorten, right? And if it stays short for too long, you can't get it back out, right? So there is some truth to that. However, when you do a lot of these and you go deep into the nuances of rotator cuff tears, there are plenty that it is perfectly safe to watch and wait, right? And really it's the smaller tears. A smaller tear, 1 centimeter with minimal, it hasn't retracted yet, that is perfectly fine. There's minimal risk on the patient side to try to rehab that, wait and see. Now, if the tear is 2, 3 centimeters and it involves certain parts of the rotator cuff and there's retraction or there's risk of retraction, that's a different conversation that we have with patients. We say, listen, there's some cost to waiting here. If you let this sit, the longer you let this sit, the harder it is going to be for me to repair it and get it to heal and give you a good shoulder. So it is a complex question, honestly. Some of them can be that way, some of them can't, and you really need to be seeing someone who does a lot of these and understands the patterns and which ones are perfectly safe to wait on and which ones aren't in terms of the long-term health of your shoulder. And then it's also your symptoms too. I mean, even if we have many patients that have small tears that have tremendous pain despite undergoing a course of physical therapy, and they don't want to live the rest of their life in pain, so we fix it. The bigger ones, I recommend fixing all of those if it's repairable, which often they are in our hands. The smaller ones, it's really dictated by the patient's symptoms and what they've done so far. So it's a complex question. There's a lot of factors that go into it, but there are consequences in some patterns of rotator cuff tear that if you don't repair this, that it may not be able to be repaired. So that is true, but it's just not true for all of them, right? That's the key. It's not true for all of them. So hopefully that answers your question.